When I started doing implants a very long time ago, nearly 3 decades ago, what we'd have to do to place these implants, we didn't have this level of visualization technology. I'd have to numb a patient up. I'd have to look at a 2D X-ray, which isn't accurate one-to-one representation of the patient. I'd then actually have to take out all their teeth, numb them up, open the gum, and then go hunting for the best sites before I started. Today, technology is so advanced that I can take these scans and I can do a virtual surgery and I can plan the position. And to have very good planning, you need to start with the highest quality data you can possibly get. And the highest quality data today is all digital. And it starts with things like taking a cone beam CT scan. And as you can see, the level of detail that it allows me to see what is going on inside a patient's skull before we surgically intervene in them allows me and my team to plan. And if we can plan everything and we know everything, where everything should go before we start, then by the time we actually come to do it, it's very straightforward. So this is a scan that we took of somebody who came and inquired with us. So as you can see, I can visualize the whole thing in 3D. What we're looking at here is not just the teeth. We're looking at the architecture of the skull as it is now. So when you have so-called gum disease, which is probably more bone disease, we call it periodontal disease. Lay people call it gum disease. When teeth are actually moving, this is an indication of bone loss. And the bone loss can be quite aggressive, as you can see in this case. All this architecture is really important for us to visualize so we can avoid anatomical structures which will cause problems. We can actually see we've got different screens here. What we do with the different screens is really interesting too. There is a blue slider, and if you slide it, if you slide it across and you pay attention to this screen over here, it actually shows us the cross-sectional view of what's going on in your jawbone. And based on that, we can tell what the quality of the bone is. We can tell what the volume of the bone is. We can tell how it will probably respond to implant treatment. And all of this detail is looked into before we do anything on you. Once I've planned the positions, I can actually 3D print in our bioengineering division a guide that will fit you perfectly. And I can deliver those implants to within 100 micron accuracy of where I've planned. When you have the surgical correction, you will have specifically made 3D printed guides, which will guide your implants to the perfect positions that we planned them to. So this, for example, is one of our surgical guides. It usually comes in 2 parts, and they're highly precise, and they're custom made for every single patient. Apart from the fact that it's a lot less traumatic for the patient, it's much faster than freehand, and it's very predictable in the positions. The position of the implants in relation to the new teeth that are going on is even more important, because what we need to calculate is the optimal balance of compromises between the bone, the implant, and the new prosthesis. If you have a look, they come out in the middle of the prosthetic. This is very, very, very important, because then the engineering of the actual prosthesis itself is far more integral. If we didn't use a guide, then we could end up with implant positions over here, over there, coming out that way. These are suboptimal positions. So it's very important that we have the optimal positions of the implants, and to achieve that, we have to use surgical guides for this level of precision consistently.
In 21D, we're doing surgeries every day, 5 days a week. Surgeries currently are done in a surgical hub in Warrington, Birchwood. Usually the clinician comes and greet the patient, have a little talk. Patients are usually quite nervous, which is absolutely normal and expected. Then we are taking the patient to the surgery. We're doing usually the upper jaw first. Surgery itself takes around 2 hours. This depends on the patient compliance. It literally should not take much longer than an hour per arch. Everything is according to the clinical circumstances and to the patient needs. So the surgery starts with giving the needles. but this is essential because pain is managed by needles. The second step is to take the teeth out, clean the infection, prepare the site for the implants and for sitting the guides. Then we go into the sitting the guides, which is secured by pins so it doesn't move and allows us a precise placement, precise delivery of the implants. Then we take the guide off. Then we take scan. It's called iMetric using photogrammetry technology. Then if patient is happy, we proceed usually to the lower jaw and the process starts again the same. After the both jaws are completed, the implants are fitted into the jawbone, then we're taking the patient to take an X-ray. It's cone beam CT scan, so it's a 3-dimensional X-ray. After that, the patient's coming back to the surgery and we're fitting the teeth.
We then fit on top of it something called a deprogrammer. These are what we call deprogrammers. These are the first set of prosthetics, and they are screwed directly onto the implants. It's often referred to as temporaries in other clinics, and they're designed to work like that. It will have bite engineered into it exactly where we need it to be while you're healing. And these are the devices that we use on the day of surgery, and we have these ready before you have surgery. So actually, immediately after the implants are put in, we fix the teeth immediately, so you have no downtime where you're waiting to have the teeth made or any of that stuff. It's instant. Then after that, at the end, we will fit your LTP, which stands for long-term prostheses. Again, we don't call them finals for a reason. It is a long-term medical device, and we make ours out of titanium PMMA. And as you can see, the fitting side, the bit that fits the gum area, is a very highly polished metal. This is the most hygienic surface you can put against gum tissue. Nothing is more hygienic than that. This is the whole reason that we do things the way we do things in 21D, because when we come to the surgical reset, we want it to be a one-off event, almost always. With this level of planning, it's even rarer than it was when I was doing it in my previous incarnation, when I was working at Evo Dental, because there I didn't have the technology I have available today to produce the guides I can produce today. So when I developed the Evo solution over there, we had to almost what we call eyeball it. And eyeballing is never the level of accuracy that you're going to get with this detail of planning, and then the ability to produce surgical guides from this. So this is just to give you an overview of how we work with the data that we take and why that full clinical assessment is probably the most important appointment we do. And then it allows us the ability to get the data that we need so we can actually sit together, analyze it in detail, and produce a 3D plan that we can execute safely for you to give us what we believe will be a long-term outcome.